the next session is about peer reviewing experience in the UK. And Sharon is going to moderate this with me. We're going to see some videos, but first I will just explain in a few words what is peer reviewing, because I don't actually know if this happens in any other countries than the UK. So a peer review is where you have some members of a team that will go and inspect a hematology service. And they will, it's a peer review because we're reviewing each other. So there'll be some doctors, some nurses, there'll be some people who are involved in sort of the finance side of things, and they will all go together to visit this hospital. And the hospital will have to, the hematology service will have to provide lots of documents about how they organize their service, what's their policies for dealing with transfusions, with a chest syndrome, all of those things. And the wonderful thing about this is that we've got patients as part of this team. So it's not just healthcare professionals reviewing other healthcare professionals. It includes patients reviewing healthcare professionals and the service. And the patients will not only speak to patients who are in this other hospital, but will also give their voice about what they think of the service. So we've got 2 videos of 2 people who've participated in peer review, and we will hear what they thought of the process.
Hi, my name is Vanessa Wills. I'm a sickle cell sufferer, HBSS, and I've been part of the hemoglobin disorder quality review program since 2014. My consultant referred me to it because I did audits as part of my professional job, and she thought that that would be a good fit for me. So I found it quite normal and easy to get on board with. How it works is, as a patient peer reviewer, we tend to focus on the HN100 of the quality review standards, and then we go around and review different hospital services based on those standards. We also get to sit down with patients who are representatives of that service and discuss with them how they find their service, what experiences they've had, good and bad, and get to just share knowledge. I've found this process to be very enlightening, and it's been interesting to realize that even within the UK, the level of service from one unit to another can be quite varied, and there may be different treatment approaches that are applied in one particular service that isn't necessarily done in the same way in another service. And it's also really good to connect with other sufferers and users of similar services and get to be enlightened by their experiences and how they found the service and dealt with their health issues as needed, basically. And then what happens is, after we've done our tour around the service, we sit down with the other reviewers, which include doctors and staff, and we assess how we consider the rating of the service for the particular standards that we're looking at. And as a patient reviewer, I do believe that our opinions are taken on board, and we usually are able to sit down and say, this is what we thought before we end the session, and then get to go.
Hi everyone, my name is June Okochi. I am a patient living with sickle cell, advocate and mentor, working really closely with the Sickle Cell Society. My day job is I work with the NHS as a commissioner, and I also was a patient rep on the peer reviews for hemoglobinopathy services across the UK. I found out about peer reviewing and having the patient perspective through my work and support on the standards when I was a patient rep on that board. And I think with the same process of developing the standards and bringing the patient perspective, which was absolutely crucial, I thought it was absolutely vital that, you know, they were actually bringing the patient representation into the process as well for the peer reviews. So the value of having the patient perspective, like everything else in life, you have to listen to your users. You have to listen to people who absolutely receive care or services from any organization. I thought it was very powerful that they had patient representation on the peer reviews. And I thought it was important that we could as the patient reps, we could actually engage with the patients of all of these services across these hospitals and listen to whatever barriers that they were experiencing with their care, or, you know, understanding their views and where change can be introduced, and just understanding some of the challenges that they might be having with their care or their clinicians, etc., and being able to feed that back into the recommendations that the review board would make to the trust, or being able to translate those messages from the patients into what could potentially improve their outcomes for the future. And I think that was really powerful, having that lived experience right in the center of change, of improvement, of recommending, you know, better care, of understanding the variation across the UK. So yes, absolutely vital. And basically, I thought it was exciting just meeting all of these patients, you know, understanding that some of us are absolutely lucky and blessed, you know, and there were levels and levels of variation in care, but knowing that, you know, their voices could count, and that we could have that rapport in a honest and balanced and measured way, and also taking all of the positive feedback, you know, and replicating that across other hospitals. I thought that was really amazing. So yeah, patient views, absolutely very important. What I wish I'd known before I started peer reviewing, I don't think there was anything quite surprising, if I'm being honest. I think, you know, we went through the training process. It was rigorous. You know, everything was explained. You know, for example, I couldn't peer review a hospital in which I received care. You know, so that was explained from the start. The fact that obviously if you're reviewing sickle, you're also reviewing TAL as well. And that was really eye-opening in itself, because I didn't have a lot of knowledge about thalassaemia, but I think through the peer review and just being able to standardize that process was important, and also meet other patient advocates and patient reps from the TAL Society who were able to bring their own experiences was really vital. I think for me, I was really lucky in a sense that because I've worked in the NHS, or I work in the NHS, I could bring a bit of that experience as well. And there were times when I had to wear two hats, because I'm a commissioner, and there are times when we had to talk to commissioners, so I would do that as well. So another question was were my views taken into account throughout the reviews? Absolutely. It wasn't necessarily my views, it was the views of patients. So the patient reps who sat on the peer reviewing board talked to other patients who actually used that local service, and all of that was fed in. We had a standardized protocol, you know, where we actually asked specific questions, and we probed, not in a, you know, in a very measured way, and asked the right questions. We didn't lead their answers, and we captured all of those responses and fed them back into the board. So I think, yeah, it's absolutely important that the patient's views are always upheld in any change process. And I think, you know, it was one of the most beautiful things I've done as an advocate and a patient representative in the sickle community. Thank you.
That's really positive. So we've got we get the impression they're really expert patient reviewers. I'm going to hand over to Sharon, who's going to moderate. We've got 10 minutes for Q&A now.
Hello, my name is Sharon Brown-Peter, and so the peer review process, honestly, it sounds like an amazing initiative that I've never heard of here. So to move forward, this question applies to both Vanessa and June, because both of them seem very professional and well-equipped, because she works for the NHS. So what would it take to be a peer reviewer, but you don't have the right background?
Hi everyone. Thanks for the invite to ASCAT. It's my first time on here, but really good to be here and listen to all the amazing stuff everyone's doing. Thank you for the question, Sharon. It doesn't take any particular type of experience. I literally became a reviewer by chance. I was on the editorial board for the Sickle Cell Standards as a patient rep, and I overheard clinicians who said they needed people with sickle cell to actually review, and I just thought, you know what, I'll do it. And I did it because I just like going up around the country. I love to travel, and I thought, this is exciting, I'm just going to jump on it and and really bring my experience as a patient as well. So you don't need any professional experience. Patients can nominate themselves if they want to. I definitely nominated 2 young patients that I mentor with no experience at all in auditing or any professional background in this sort of stuff. So you go through training, and the QRS, the Quality Review Service, train everyone. So you go through training, you get all the details required, what you should be looking at. We go through a mock-up type process, so you know what to expect. And then you bring your own sort of initiative, feedback, the experiences from patients. Yeah, it's you don't need any sort of specific skills to do it.
It's got anything similar in their country? I know we've got people from France and Spain.
Hi, my name is Laura Ruth. I'm in Ireland, in Dublin. And I think peer review, from the explanation from Ms. Roy there, it felt like it was healthcare professionals reviewing other healthcare professionals, but at the same time having a patient representative to put in their voice or their feedback or opinions on how the service is run. We have something of a sort similar to that, but here in Dublin, it's called the patient voice or patient representatives. And in one of the major hospitals, actually, it's where the adult hospital for sickle cell patients and thalassaemia patients. I represent on the patient representative board. But that patient representative board it has all patients from various areas, cardiology, oncology, sickle cell, everywhere, but also family members of patients who attend the hospital. So from those patients, patients can decide to sit on any other board, which I think this sounds similar to what the peer review is. And just like I think it was June explained, I don't think you need any experience, especially for sickle cell. I think your own experience with the condition, having been a patient, you attend the services, you go through this, there is something that you want. And I think what they look for is your voice in you adding to what they have prepared and saying whether you're comfortable with or you're happy with it, or there is something you would like to have changed. And I think it's all about the patient voice. You don't have to agree with what the healthcare providers are putting there. You just have to share your opinion. I don't know if I'm right, but I'm feeling that it is similar in Dublin being patient representative and in the UK being a peer review. Please correct me if I'm wrong, Naomi.
Laura, Laura, there's lots of similarities, definitely. And it's great to hear that it's working in other countries as well. Does anyone else have any experience in any other countries?
Hello, it's Jenna. We do not have peer review in France, from what I know. We have like patient representatives, so we can't really say that any patient can be one, because you need some kind of training. It only lasts between 4 and 8 hours, so you have different aspects of the disease, but we do not have like the same system as you have in England, and it's a great thing because I didn't even know that it existed. So I'm sure we can like talk about that with people who are involved in England and see if we can see something like that do something like that in France.
I'm just wondering whether EuroBloodNet might be able to do something all across Europe, whether that's something EuroBloodNet could take on to promote peer review. Subarna's asking a question in the chat. Does anyone have patient user forums in their hospitals?
Yeah, so I get my care in London. We've got a support group, which I'm part of. It operates virtually now because of COVID. But yeah, Oleander, for example, sits on that group as well. So support groups in the UK are basically patient forums or groups that come together within their hospitals to discuss any areas where we could influence change, or if there are any problems with people's care, we can talk about it and engage with the doctors, the hematology teams, or even like managers, senior managers in the hospital. So my support group is called Solace, and we formed it many, many years ago. So basically, we used to meet every month, and then we started becoming a virtual group. We also have a WhatsApp group, and myself and Oleander, for example, sit on the board. Oleander runs a parent carer group, for example. She used to run coffee mornings for parents with sickle cell kids. And yeah, we just talk about any issues we have, but we also give positive feedback where we think things are working, whether it's treatment plans, A&E, stuff like that. So
a quick question as well. How do you think the peer review process can share good practices?
June, do you want to answer that? It's about how you think, if you've been to a hospital and you've seen good practice, how do you make sure that that gets shared and that we can replicate it somewhere else, and you don't feel all you've done is give feedback about that one place?
That's a really important question, because I think I mentioned in my video as well that we also sort of steal ideas and we replicate some best practice bits from other hospitals and share them with other areas where maybe that particular model hasn't been adopted. And basically, through the recommendations, we also say, have you considered X, Y, and Z? Or we share with the clinicians of that trust to say, this is what has been done in other areas, for example. But also because the report, the recommendations report is published publicly, people have access to that information. The patients have access to it, clinicians and the public have access to it, so they can actually look at the report and see where, a particular hospital has been rated as very safe. They can look at some of the best practice, replicate that, but also people like Subarna or the clinicians that sit on the review board also have their own hospitals reviewed. So there's a learning process in itself in that sense. So yeah, I don't know if Subarna wants to add to that.
Where this report could be found?
Yeah, it's on the website for the quality review service.
I'll share the link here in the chat.
Yeah. It's a really good idea for people to have a look at. Good idea.
I'm just trying to reconcile when Ria did a presentation during the COVID, the experience that she's been having during the hospitalization before the COVID and just in general as a sickle cell patient in the UK. And if you have I know in Australia, I don't think we do. We can request if we want to have audience with a hematologist. And this is a very good idea that I think we'll have to also suggest to our hospitals. But I'm just trying to reconcile what Ria said, the experience that she's been having in the hospitals before the COVID, and she thought this was the best experience at the hospitals during this period. With all the issues that has been happening in the UK, if you have patients that actually sit on the boards or on the peer reviews, have you ever identified these issues? Have they been addressed? And if they have, what has been said or what has been done about it? And if they haven't, why haven't you sort of identified these issues that the patients have been going through? Because I know even last year, this was one of the questions, Vanessa and Ria, the similar experience that you talked about. If you actually have patients that do these peer reviews, which I feel is a fantastic idea that should be done in other parts of the world, but I'm just trying to reconcile why you still have these issues. For example, you don't have a ward all these years, and if you have patients that actually, are being, you see what I'm trying to actually, I can't reconcile the two.
And you heard about peer reviews when we met last year, Agnes, at ASCAT, and obviously Vanessa, she told me, and then we had a patient review which Vanessa actually held, and obviously I was like, oh my god, like obviously we knew each other from ASCAT, and since then that's been it. So I make myself have a voice in my hospital, but everybody else actually does not. A lot of the patients, we've got something called like where you can like bring all your issues to. The sickle patients don't feel like it's something that they actually want to go through, but there's no particular patient review that I am aware of that is actually there. I've only been to one in my whole adult
Can I just step in here to answer Agnes's question, Maria? So I'm Savannah. I work in King's, and I am just leading the review program this year and for the last couple of years. And actually, Ria, in terms of, I think we definitely might need to be more, putting our adverts out there for inviting people to come and join as patient representatives in these reviews, because I think we've struggled this time to get people on board. So I guess meetings like this are very useful to get our message across that we do need to keep doing that. And in terms of the question, Agnes's question, I think I might be able to explain what happens. So if I'm right in thinking your question, Agnes, is you wanted to know if the reviews are in place, why is it that there is still a problem? Why could the reviews not address the problem? Is that what you're saying? So I think that's a very good question. Yeah. So we've published on information that we've had as a result. I think some of it is to do with limitations of resources. And some of it is so. For instance, we there will be lots of other similar kind of programs of assessments, like in hemophilia or in nephrology or in intensive care or in emergency services. So every the peer review system is not unique just for hemoglobin disorder. So there is lots of others as well. And but we find that still to this day, I think it's a lot more a big struggle to get sickle cell and thalassaemia services recognized than we get some of the others. So, for instance, we did a survey of all the. So when we come and review, say you are a hospital doctor and doctor or nurse, you're running your service. I come to review your service and then put in these recommendations, and then six months later, we send you a questionnaire to say, well, all these recommendations that we've put in, how much of it have you been able to, how much of it have you been able to initiate in your own hospital? Remember, the doctors and nurses or the patients or most people are extremely keen to have these, we're all on the same side. It's basically, so what we've seen is exactly. So what we've seen is when the similar questions are asked to kidney doctors or diabetes doctors and so on, they tell us that actually they've been able to, say enact, 80% of the recommendations. Whereas consistently we find that sickle cell services are maybe 20, 30, 40% able to do it. So there seems to be a bit of, work left to be done in order to improve the profile of sickle cell and thalassemia services in it's a pie, everyone wants a share of the pie, and it's just trying to put your case forward to make, to say, well, this is a very, very important group of patients who cannot be forgotten. And I think we have recently changed in the UK how money is spent on the disease. And somehow that is, because it's all centrally funded and specialist funded, so I think it's somehow people are taking a little bit more notice of sickle cell and thalassemia as a whole. And it's possible that when we do the next round of reviews, we might see that people are being a bit more responsive to these deficiencies, if you see what I mean. So I think it's first step is to identify the deficiencies, which we have done time and time again. Second thing is to see whether those deficiencies are being addressed. And I think we've not been very good at being able to implement those. And I think the work that we're continuing to do is to try and see how that gap can be bridged.
Thank you, Subarna. That's really great. And I think it's nice for everybody to be aware of this process. Subarna has shared the link in the chat. Mariangela can share it again with everybody afterwards. We can mention it in the summary. And let's see if EuroBloodNet can take it forward across Europe, and we can think about how we could do that in other countries as well. So
can I jump in? Sorry, Naomi. Can you hear me? Can I jump in here? Because I know the lady who spoke at first said something about the quality review service. Yeah. But as a patient who's been treated in the UK for over a decade, this is the first time hearing about patient reviewing. Yeah. And so I'm interested in this. What are the concrete steps I can take to becoming a patient reviewer?
Well, Sola, because I know you, I can send you the information.
No, but if you didn't know me, just anyone at all, what could they do?
I think you would be asking your hematologist. You would say after today's meeting, you would say, I heard about this, please can you tell me more about it? Or you can Google, I mean, it's a long name, I can't even say it, what the quality review service is. It's quite a long name, but by all means, we will think about how we can make more people aware of it.
Okay. I think that's a gap that you've identified that is not well advertised. So maybe we can take that up.
Absolutely.
Also curious. Yeah, I was even going to ask, what would anyone suggest to amplify this peer reviewing process? What would anyone say to make sure people know more about the process?
Well, let's make sure we present it on Saturday. I'm really sorry. It's not that I don't think it's important. It's just that we have got to move on to the next session because we're already running late. But I'm glad there's so much enthusiasm about peer review because it is super important and it does make a difference. And I think Subarna would hopefully agree with me that even though there's still lots of things that could be improved, actually things have improved over the years since the whole peer review process has started. We're going to go ahead and move on to the why I took part in research.